My name is Lahiru Kanchana Vikramatunga, and I'm living in Australia right now. And I'm a Canadian citizen, and my age is 30 years old. And I do need a working visa or some sort of sponsorship in order for me to work in Australia. I have worked in a variety of settings, and I also have completed my BSCN. So in the future, I can eventually get my RN license as well. And I worked in the operating room, post anesthesia care, same day surgery, acute medicine, orthopedic surgery, complex continuing care. And I also have a lot of experience in aging care. So I worked in long term care and also retirement homes. Um, and for in terms of like working in long term care, it's mostly been medical medicine administration, working with families in order to improve patients' outcomes. And so it's family centered care. And just mostly like leadership positions in long-term care, so like just managing like personal support workers, and also like properly documenting all the information. And in terms of surgical units, it's mostly just prepping patients for surgery and also taking care of them while during the surgery in the operating room, and also after they come out of the surgery, caring for them in the PACU, the post anesthesia care unit. And sometimes I've also been in the ICU as well. And yeah, in total, I have experience in acute care and a little bit like in intensive care as well. So I have a mix of both long-term care experience along with acute care in the hospital as well, and I feel I'm well qualified for the position. One example which I work closely with other nurses, doctors, and other healthcare professionals to provide safe, competent care was during the PACU unit that I was in. There was a patient where he had gone knee replacement surgery, and he was not recovering well. So like he was going into shock. So like I was working closely with other nurses and managing the patient's condition. So like giving meds and like acting on behalf of the patient as in a timely manner, along like depending how his conditions dictated during that time. So yeah, and there were a little bit of complications. So there were like other health professionals who had to get involved. So there were X-rays that needed to be done, and so like I had to work with X-ray technicians, like medical students, and also the nursing managers to make sure that the patient was given the needed medications properly. So that was one of the specific examples that I had worked with other nurses and other health professionals. Yes, I do have my registration as an enrolled nurse with AFRA, and I can give you the registration number, which is NMW 00040144214. So it's an active general registration with AFRA that I have. I have been in Canada since 2008, so it's been several years which I have been in Canada, and I'm not a big fan of the weather. So the winter and also work life balance in Canada, like I prefer Australia much more, and I like the environment in Australia, and I have been to Australia several times. And so I do like the country itself, and like the culture that Australia has to offer. And also, as an enrolled nurse, there is a lot of opportunity to work, and there's a lot of learning that can be done, and there's like advanced placements that we can get into. So I'm very interested in working in Australia.